So now we're going to start the discussion about the tongue. Now this is the dorsum of the tongue. Okay. Now we're going to divide the dorsum of the tongue into anterior two-third, and this is the base of the tongue. Okay. Now the base of the tongue includes the posterior one-third of the tongue, and this is the posterior most part of the tongue. So posterior one-third and the posterior most part of tongue together called base of the tongue. So now we have one sulcus that is present between the anterior two-third of tongue and the base of the tongue. What is that? Sulcus terminalis. So sulcus terminalis, please write, which divides the tongue into anterior two-third and the base of the tongue. Okay, right. Now in the posterior one-third of tongue, we have lymphatic aggregation that is called lingual tonsil. Lymphatic aggregation in the posterior one-third of tongue, and that is called lingual tonsil. So these are nothing but these are lingual tonsil. Okay, right. Now in the anterior two-third, we don't have any lymphatic aggregation. Okay, instead we have some projections of the lamina propria, and that is called papilla. So in the anterior two-third of tongue, we have papillas. Okay, number one, this is the circumvallate papilla. That is the circumvallate papilla. Now circumvallate papilla present, yes, in front of the sulcus terminalis. Okay, right. Number two, so these raised margins will mark here. So these are the fungiform papillas. Fungiform papillas. And in the margins of the tongue, we have foliate papilla. And we also have numerous filiform papilla. So we have four papillas. We're going to write circumvallate, fungiform, foliate, and filiform. Okay, right. Now circumvallate papilla. See, circumvallate papilla, see, I told you these papillas are nothing but the projections of lamina propria. They contain taste buds. So next heading, taste buds. Circumvallate papilla, they have a taste buds. Fungiform papilla, they have a taste buds. Foliate papilla, they have taste buds. Whereas filiform papilla, they do not have taste buds. Why, sir? Filiform papilla function to provide the grip for the food substance. So it is not having taste buds. Okay. Next one, the circumvallate papilla. Now these papillas are lined by what is the epithelium? So the lining epithelium will be, they are non-keratinized, stratified squamous epithelium. Stratified squamous epithelium. Fungiform papilla, same. Non-keratinized stratified squamous epithelium. Foliate papilla, again same. Non-keratinized stratified squamous epithelium. But filiform papilla is lined by keratinized stratified squamous epithelium. Now again, why keratinizer? Because I told you the function of filiform papilla to provide the grip for the food substance. Okay, we have to hold the food substance so that the taste buds give their secretion. We can appreciate the taste. Okay, so the function of filiform papilla, yes, not to appreciate the taste, to provide the grip to hold the food substance. That is why it is lined by keratinized stratified squamous epithelium. Okay, right. So one last thing about the papillas, their nerve supply. Now these papillas are supplied by chorda tympani nerve, except circumvallate papilla. Circumvallate papilla, though it is present in the anterior two-third of tongue, developmentally it is coming from the posterior one-third of tongue. Posterior one-third of tongue is coming from third arch. Now what is the nerve of third arch? Glossopharyngeal nerve. So circumvallate papilla, it is supplied by glossopharyngeal nerve. The remaining papillas, they are supplied by chorda tympani nerve. Chorda tympani nerve. Okay? Yes. So the remaining papillas are supplied by chorda tympani nerve, except circumvallate papilla, it is supplied by ninth nerve, glossopharyngeal nerve. Okay, next one. We are seeing the sensory supply. The anterior two-third of tongue Gentle sensation by lingual nerve, taste sensation by the chordae tympani nerve. Posterior one third of tongue, gentle sensation, taste sensation, both are by glossopharyngeal nerve. The posterior most part of tongue, the gentle sensation and taste sensation by the internal laryngeal nerve. Okay, right. Now, any ulcer in the anterior two third of tongue, the pain referred to. So, pain referred to via which nerve? So, ulcer in the anterior two third of tongue, the case of ulcer in the anterior two third of tongue, the pain referred to external ear only. Okay, via which nerve, sir? See, lingual nerve carries gentle sensory fibers, branch of mandibular nerve. Again, another branch of mandibular nerve supplies the external ear. Auriculotemporal nerve. Auriculotemporal nerve supplies the auricle and the adjoining temple, adjoining area of auricle and temple. So, pain referred to external ear due to which nerve? Auriculotemporal nerve, branch of mandibular nerve, lingual nerve, branch of mandibular nerve. Fine. In the case of ulcer in the posterior one third of tongue, the pain referred to middle ear. Pain referred to middle ear. Via which nerve, sir? Glossopharyngeal nerve is giving which branch? Tympanic branch. The tympanic branch of glossopharyngeal nerve forming tympanic plexus. Tympanic branch of glossopharyngeal nerve. And the posterior most part of tongue, ulcer in the posterior most part of tongue, again pain referred to external ear only. Due to which nerve? Yes, auricular branch of vagus. Due to auricular branch of vagus nerve. Okay, right. So this is about the sensory supply and the relevant apply. Okay, right. Next, we're going to see the muscles of tongue. So muscles of tongue. So tongue receives the muscle from the surrounding bones. Now from the palate to the tongue, palatoglossus. From the mandible to the tongue, from the genial tubercle to the tongue, genioglossus. From the hyoid bone to the tongue, hyoglossus. From the styloid bone to the tongue, styloglossus. The palate will be here like this. Hard palate will be like this. So from the hard palate to the tongue, there is a palatoglossus. So we have four muscles. The tongue, genioglossus, hyoglossus, palatoglossus, and the styloglossus. Now all these muscles are coming from occipital somites. So all the muscles of tongue derived from occipital somites. Occipital somites, except palatoglossus muscle. Palatoglossus muscle, it is the connecting muscle from between the palate and the tongue. So it is not coming from the tongue muscle. It is taking origin from the palate group. Palate muscles coming from which arch? Fourth arch. Okay. So all the muscles of tongue derived from the occipital somites. Okay, except palatoglossus, which is coming from fourth arch. Okay. Now the same question can be asked in a different way. All the muscles of tongue supplied by, all the muscles of tongue are supplied by hypoglossal nerve, 12th nerve, except palatoglossus, which is supplied by pharyngeal plexus. Same question only, but in different format. Okay, right. So this is about the source and the nerve supply of the muscles. Now what are the actions of these muscles? Now see the diagram. Right. Now first genioglossus muscle. Genioglossus muscle is coming from the genial tubercle to the tongue. Origin from the mandible to the tongue. I told you already. If you want to know the action of any muscle, insertion point, move towards the origin point. So tongue is moving towards the origin point like this. So tongue is moving towards the origin point like this. Number one. Again in this side. So tongue is moving towards the front side and the tongue is also moving inferiorly. Why? Because origin point present in the front side and the inferior aspect. So tongue is moving in the front side and the inferior aspect. So genioglossus muscle have two actions. Number one, protrusion, and number two, depression. Okay, we have two actions for genioglossus muscle. Okay, right. So now out of these two actions, again the best action is protrusion greater than depression. And please remember, genioglossus, it is a only muscle for tongue protrusion. Okay, genioglossus, it is the only muscle for tongue protrusion. Only muscle for tongue protrusion. Okay. If the muscle is not there, then tongue will roll back and occlude the oral passage and nasal passage. Okay. So that is why the genioglossus muscle is called safety muscle of tongue. This muscle is called safety muscle of tongue. Now in the larynx, we have safety muscle of larynx. That is posterior cricoarytenoid muscle. We see in larynx. Now in the tongue, the safety muscle of tongue is genioglossus muscle. Okay. Next one. The hypoglossal muscle. Now see the hypoglossal muscle. Hypoglossal muscle attached to the side of the tongue. So it pulls the side of the tongue and making the dorsal surface convex. So muscle attached to the sides of the tongue. It is pulling the side of the tongue and making the dorsal surface convex. So hypoglossal muscle make the dorsal surface a convex one. And what about the styloglossus muscle? See, styloglossus muscle from the styloid process to the tongue. So tongue will move towards the styloid process. So again, the styloid process is behind the tongue and above the tongue. So elevation and retraction. Okay, right. And what about the palatoglossus muscle? See, palatoglossus muscle elevates the tongue. Elevates the tongue. Yes. So these are the actions of the muscles of tongue. So out of all the muscles, which muscle is called safety muscle of tongue? Genioglossus muscle. Why safety muscle? Because that is the only muscle which protrude the tongue. The muscle is not there, the tongue will roll back and occlude the oral passage and nasal passage. It is the only muscle for tongue protrusion. That is why this muscle is called safety muscle of tongue. Okay, right. Next, we're going to see the relation of hypoglossous muscle. Already we know the hypoglossous muscle origin, hypoglossous muscle nerve supply and actions over. Now we're going to see the relations of hypoglossous muscle. Now see the diagram. Now the diagram, yes, we are seeing the lateral view, and hypoglossous muscle is having two relations. Now we are seeing the hypoglossous muscle like this. Okay. Now the surface what we are seeing is the lateral surface, and we also have this surface, medial surface, lateral surface, also known as superficial surface. This surface, medial surface, also known as deep surface. Okay. So superficial relation or lateral relation of the hypoglossous muscle. Now lateral to hypoglossous muscle, we have number one, lingual nerve. This is our lingual nerve. Okay. So lateral to hypoglossous, number one, lingual nerve. Number two, lingual nerve suspending one ganglion, submandibular ganglion. Okay. And from the submandibular ganglion, yes, we have submandibular gland and submandibular duct. Okay, right. And close to greater horn of hyoid bone, we have the hypoglossal nerve. So these are the 5 structures which are present superficial or lateral to hypoglossous muscle. What are those? Lingual nerve, submandibular ganglion, submandibular gland, submandibular duct, and the hypoglossal nerve. Superficial or lateral relation. Now deep or medial? Deep or medial relation of hypoglossous muscle. So now we remove the hypoglossous muscle and we are seeing the deep surface. The deep surface, we are seeing this muscle. What muscle? Stylopharyngeus muscle. Stylopharyngeus muscle. Okay, right. Next one, glossopharyngeal nerve. And we are seeing one muscle here. I am writing as MC, that is a middle constrictor. Number 3, middle constrictor. And number 4, we are seeing one artery here. Which artery? Lingual artery. So these are 4 structures which are present deep to, yes, hypoglossous muscle. What are those? Stylopharyngeus muscle, glossopharyngeal nerve, middle constrictor muscle, and the lingual artery. Okay, right. Next, we're going to see the lymphatic drainage of the tongue. So the lymphatics from the tip of the tongue. Lymphatics from the tip of the tongue drain into submental nodes. Submental nodes. Now the lymphatics from the anterior two-third. The anterior two-third, the side of the tongue. From the sides, the lymphatics draining into unilateral submandibular nodes. Now from the central part of anterior two-third and the lymphatics from the posterior one-third of tongue, they are draining into bilateral jugulodigastric and jugulo-omohyoid nodes. They are draining into bilateral jugulodigastric and jugulo-omohyoid nodes. Jugulodigastric and jugulo-omohyoid nodes. Whereas lymphatics from the posterior most part of tongue. Lymphatics from the posterior most part of tongue, which is draining into upper deep cervical nodes. Okay, so that's all about the lymphatic drainage of the tongue. Now we're going to see the muscles of tongue and palate. Now this is the bony prominences. Now this is our hyoid bone. Okay, so now from the hyoid bone to the tongue, this is our hypoglossal muscle. Okay, now next one, mandible to the tongue, that is our genioglossus muscle. Now from the palate to the tongue, that is our palatoglossus muscle, this one. From the palate to the tongue, palatoglossus, and there is a styloid process to the tongue, that is a styloglossus muscle. These are the four muscles we have: genioglossus, palatoglossus, styloglossus, and hyoglossus. Now we are seeing the skull from the back side. Okay, you are on the back side and you are seeing the front side. Now here we are seeing the muscles of palate clearly there. Now this is the tensor palatini muscle. That muscle they highlighted in yellow color. Just medial to that you are seeing the levator palatini muscle. And this is our musculus uvulae muscle. And this is the pharynx muscle from palate to pharynx, palatopharyngeus muscle. Now these are the four palate muscles we have. All the muscles of palate are supplied by our pharyngeal plexus except this muscle, tensor palatini muscle, that is supplied by our mandibular nerve. The trunk of the mandibular nerve will supply the tensor palatini muscle. So now we're going to discuss the hypoglossal nerve. Now what is the function of the hypoglossal nerve? See, hypoglossal nerve is purely motor nerve. Okay, it is a pure motor nerve. Now hypoglossal nerve, pure motor nerve. Now what is the functional column? It contains general somatic efferent, GSE column. GSE column contains third nerve nucleus, fourth nerve nucleus, sixth nerve nucleus, and 12th nerve nucleus. I hope you know that. Right. Now hypoglossal nerve, which emerge between, yes, it is emerged from medulla and it is emerged between pyramid and olive. Okay, so between pyramid and olive, yes, hypoglossal nerve is emerging out. So by the side we can write the course. So hypoglossal nerve, which emerge from the medulla between the pyramid and olive. Okay, the hypoglossal nerve is arising from the numerous rootlets, and then these rootlets they join together to form two rootlets, and the two rootlets they form one single trunk, and that single trunk is passes through hypoglossal canal. So hypoglossal nerve passes through hypoglossal canal. Hypoglossal nerve passes through hypoglossal canal. This is very important. Hypoglossal canal transmit only hypoglossal nerve. The point is, hypoglossal nerve is not passing through jugular foramen. Jugular foramen transmit 9th nerve, 10th nerve and 11th nerve, not 12th nerve. 12th nerve passes through one separate opening called hypoglossal canal. Fine. Now, after coming out of hypoglossal canal, the hypoglossal nerve is deep to hypoglossal nerve, 12th nerve is deep to this artery. Which artery? Internal carotid artery, and also the 9th nerve and the 10th nerve. After emerging out of the hypoglossal canal, the 12th nerve is situated deep to internal carotid artery, 9th nerve and 10th nerve. Then the hypoglossal nerve descends down. Okay, it is coming down. See here, it is coming down and reach the interval between internal carotid artery and internal jugular vein will be here. Okay, descends down and reach the interval between internal jugular vein and the internal carotid artery. I'm talking about this area. Okay, right. So now the nerve is present between internal carotid artery and the internal jugular vein. Now from here, the nerve is passing horizontally. See here, the nerve is passing horizontally like this. The nerve is crossing internal carotid artery, external carotid artery, and the nerve is also crossing the loop of lingual artery. Okay. So after reaching the interval between internal jugular vein and internal carotid artery, the hypoglossal nerve pass horizontally and cross internal carotid artery, external carotid artery, and the loop of lingual artery. Okay. After crossing the loop of lingual artery, now see the nerve. The 12th nerve, which reaches the posterior border of this muscle. What muscle? Hypoglossal muscle. Just now I told you, hypoglossal muscle, superficially, laterally, which nerve is present? Our 12th nerve, hypoglossal nerve. Okay. And one bony landmark, I told you in the carotid triangle itself, hypoglossal nerve is very close to this bone, that is the greater horn of the hyoid bone. Okay. And above that, we see one gland. That is our deep part of submandibular gland. I am writing as deep part of submandibular gland. So the nerve, see the diagram, the nerve reaches the posterior border of hypoglossal muscle, and the nerve is passing superficial to hypoglossal muscle between the deep part of submandibular gland and the greater horn of hyoid bone. Okay. Now we write this relation. So the nerve, hypoglossal nerve, which reach the posterior border of hypoglossal muscle, and the nerve pass superficial or lateral to hypoglossal muscle between the two structures, the deep part of submandibular gland and the greater horn of hyoid bone. Greater horn of the hyoid bone. Okay, right. Then next one, the hypoglossal nerve, which is resting on the genioglossus muscle, which in turn reaches the tip of the tongue and divided into numerous branches and supply the various muscles of tongue. Okay. So the nerve resting on, hypoglossal nerve is resting on genioglossus muscle and reaches the tip of the tongue. Okay, right. So this is the course of the hypoglossal nerve. Right. Next, we're going to add branches. Okay. Now, the hypoglossal nerve branches supplies all the muscles of tongue except palatoglossus muscle. Motor branches to all the muscles of tongue except palatoglossus. Palatoglossus supplied by pharyngeal plexus. Okay. So hypoglossal nerve, which supplies all the intrinsic muscle, extrinsic muscle, all the muscles of tongue supplied by the hypoglossal nerve except palatoglossus, supplied by pharyngeal plexus. Number 2, via C1 fiber. Via C1 fiber, see the diagram, the hypoglossal nerve is giving meningeal branch. Okay. So via C1 fiber, the hypoglossal nerve gives a meningeal branch. Okay. And this via C1 branch, the hypoglossal nerve supplies 2 more muscles. See here, I'm talking about these fibers. What are those? One is our geniohyoid and another one is our thyrohyoid. See these 2 muscles. So C1 fiber via hypoglossal nerve supplies geniohyoid muscle and thyrohyoid muscle. So via C1 fiber, hypoglossal nerve gives meningeal fiber. Okay. Number 2, which gives branch to thyrohyoid muscle. thyrohyoid muscle and geniohyoid muscle. See, I told you already about this thyrohyoid muscle, geniohyoid muscle in the ansa cervicalis itself. Just one small brush up. Okay. So C1 fiber via hypoglossal nerve give a branch to thyrohyoid muscle and geniohyoid muscle, and which also gives the superior root of ansa. This one. This is our superior root of ansa, descendants hypoglossal. So via C1 fiber, hypoglossal nerve gives 3 branches: meningeal branch, branch to thyrohyoid and geniohyoid, and also gives superior root of ansa, which is also known as descendants hypoglossal. Okay, right. So that's all about the branches. Next, we're going to see the hypoglossal nerve injury. Now, in the case of hypoglossal nerve injury, what are the features? Number 1, ipsilateral tongue atrophy. Ipsilateral tongue atrophy. Okay. Number 2, the tongue deviation. The tongue deviate to which side? See, tongue protrusion will be like this. The muscle of 2 sides, they converge in the median vector like this. Now, in the case of right side hypoglossal nerve injury, the right side genioglossus muscle is not working. Now, left side genioglossus muscle try to meet the other side muscle in the median vector, but the right side muscle, right side hypoglossal nerve is not working. Now, the tongue is deviating towards which side? The tongue is deviating towards this side, right side. There is a lesion side. So, in the case of hypoglossal nerve injury, tongue deviation towards the lesion side. Tongue deviation towards the lesion side. Towards the lesion side or same side or affected side or ipsilateral side. They can give any of these words. Okay. So, what is the meaning? In the case of right side hypoglossal nerve injury, tongue deviates to right side. Okay. Right. Now, apart from tongue muscles, 2 more muscles paralyzed. What are those? Apart from tongue muscles, 2 more muscles paralyzed. What are those? Geniohyoid muscle and thyrohyoid muscle. So, geniohyoid muscle and thyrohyoid muscle, just now I told you, these 2 muscles get the nerve supply from C1 fiber via hypoglossal nerve. So, geniohyoid muscle and thyrohyoid muscle, they also paralyzed. Now, what will happen because of this, sir? Now, because of this, larynx will deviate. Okay. Now, again, right side hypoglossal nerve injury, right side geniohyoid, right side thyrohyoid muscle is not working. Clear? Right. Now, left side thyrohyoid muscle, left side geniohyoid muscle is normal. Why? Left side hypoglossal nerve is normal. Left side thyrohyoid muscle is normal. Left side thyrohyoid muscle is coming from the thyroid cartilage to the hyoid bone. Thyroid cartilage is a part of larynx. So, larynx is moving towards the hyoid bone. The thyroid cartilage moving towards the hyoid bone. So, larynx is moving towards the hyoid bone. Larynx is moving on which side? Left side. Left side is the normal side. So, in the case of hypoglossal nerve injury, larynx is moving on which side? Normal side or opposite side or contralateral side. Okay. So, very important point. Larynx deviate. Larynx move towards the normal side or active side or opposite side or contralateral side. Okay. This is very important. So, in the case of hypoglossal nerve injury, tongue deviates towards the lesion side and larynx deviates towards the normal side. Clear? Yes. So, now, for example, the patient is having right side hypoglossal nerve injury. Now, tongue deviates to which side? Tongue deviates to right side. Very good. What about larynx? Larynx deviates towards left side. Very good. So, this is what happened in the case of right side hypoglossal nerve injury. Okay. Right. So, that's all about the tongue.